Some of the most common symptoms of major depression are a general change in mood to where a person is feeling much more sad or down or negative than usual, and a lack of just enjoyment in regular activities. Some people can tell you when they're feeling these things, but for a lot of people, the signs they may show will just be a change in their behavior, an outward change in how their mood is appearing to be when they're interacting with other people, but also changes in their self-care, in their activities of daily living, and changes in appetite and sleep schedule can sometimes be signs of depression as well. It's a good idea usually to start a conversation with the person about how they're feeling. Asking them straight out if they're depressed may not get the best response, but just starting a dialogue with someone about how they're feeling and how they feel like life is going for them will usually lead someone to open up and discuss their feelings. The sooner depression gets treated, the sooner the person can get back to their usual level of functioning. Depression is a very treatable condition, but the treatment takes usually at least weeks to sometimes months once a major depression is established to get a person really back to functioning. During that time, a depressed person can lose gains that they've made in their interpersonal relationships, in their work progress, and in their school progress and other areas of their life. The sooner you can get them back to functioning well, the less loss they're going to have and the better they'll be able to pick up with their usual life. The first step in treatment is to get a good assessment, to spend the time really talking to the person and getting an idea about what their baseline level of functioning is and how much of a change they're having and what symptoms they are having so you can come to a good diagnosis. Depression can be treated in a variety of ways. For many people who are having mild to moderate depression, psychotherapy itself can be a very effective treatment. Regular therapy sessions, especially with what we call cognitive behavioral therapy, can produce a great deal of improvement over a few weeks. Another form of treatment that is often used is medication. There are a lot of antidepressant medications on the market now. They all are effective, but they certainly aren't all exactly the same. Talking with someone and getting a full medical history is usually important to making a selection of what kind of medication might be most helpful for them. And then staying connected with the patient for treatment is very important because depression isn't something that can be treated with a single visit or in a short period of time. It usually requires many visits over weeks to months to really see an improvement and make sure that improvement is sustained. If you know that something is coming up in your life that may be extra stressful, staying on a stable sleep schedule is very important to mood stability. A lot of people with depression will suffer big changes in their sleep cycle. If you can just try and make sure you're getting regular rest and not getting overly exhausted, that can help to prevent it. Regular exercise can be an important factor in helping people to prevent depression and sometimes can play a part in treating depression once it starts. Making sure that use of alcohol is not getting to be excessive and is not starting to affect a person's mood also is a good step to making sure that depression doesn't get worse. The worst case outcome of depression is suicide, and it's something that we have to be very careful to screen people for when we're concerned about changes in their mood. A lot of people will go with feelings like that and not feel comfortable talking to family or healthcare providers about it until it's too late. So if you think that someone has had a change in their mood or is getting depressed, it's a good idea to ask about it and to make sure that is getting addressed, because if it's not, it can be something that once it gets to that point, it's obviously too late, and if you can try and treat the depression or at least address those thoughts earlier, you're much safer. Even though treatment of mental health conditions is much more common than it was even a few years ago, for a lot of people there's still a stigma associated with getting treatment for depression and other mental health conditions. It's a big problem because it prevents people from coming in to get treatment when they might really benefit from seeing a therapist or a doctor. It's important to try to make it clear to people that these are normal conditions, emotional problems are a normal part of life, and that these are very treatable conditions, not something that anyone should be made to feel ashamed of or needs to cover up, but rather something that once openly discussed can usually be treated. More than 19 million people in the United States suffer from depression every year. It's a treatable condition, and I hope this has been helpful in providing some education. For more education and more information, please go to conehealth.com/behavioral health. I'm Dr. John Clapacs. Thank you.